everyone, I'm Ashley from the Back to Health Wellness Center, and I'm a registered massage therapist here. So pregnancy massage is really beneficial, can really help mothers regardless of what term of pregnancy they're in. So one of the things we can do from a massage perspective is really help with a lot of low back pain, especially from the added shift of weight from carrying the baby the whole entire term. So we can help with pillowing and different positions to help alleviate that back pain from a massage point of view. Another thing we can really do to help is also swelling. So a lot of time mothers will come in, especially usually in the third trimester, with a lot of swelling in their feet, in their hands, and depending on certain conditions that pregnancy can cause, we can help to alleviate some of those conditions and help to assist along with the pregnancy throughout the multiple stages.
Hi everyone, I'm Dr. Kathy Van Ziel. I'm the naturopathic doctor here at Back to Health Wellness, and today I'm here to talk to you about pregnancy and how naturopathic medicine can help. So as many of you I'm sure are already aware, the process of bringing a child into the world can be one of the most rewarding experiences you'll ever go through, but it can also be one of the most challenging. So I am here to help you through that process. For women who are currently pregnant, problems like nausea, the morning sickness that won't go away, indigestion, reflux, the fatigue of growing a tiny human, later stages of pregnancy as well as you're getting bigger and you're having more weight around your backside as well. Looking at things that will help to keep you in balance and help you to cope through these things. We look at nutritional factors, we look at hormonal factors, we look at immune factors, and we look at stress-related factors as well. I usually do a lot of nutritional interventions, supplement interventions with my pregnant patients so that you can have a happy and healthy pregnancy. On top of that, one of the other therapies that I use a lot is acupuncture, which can be very successful. And also a very relaxing process to go through while you are, again, building that tiny human. In the later phases of pregnancy, some of the things that we focus on as well is getting your body strong and ready for the process of labor itself. So there are specific herbs that we can use that will help to actually tone the uterus, strengthen the uterus, and make it strong so that you are ready to go. And as you are approaching that due date, one of the most common things that I'm doing with my patients is actually helping to bring along more of a natural induction. So again, acupuncture can be very useful in those particular cases. Beyond that, so I also have a number of patients that are struggling with infertility. They've been trying, they're frustrated, they don't know what's going on. They've already been to see specialists a lot of the time, have been told that there's nothing that they can do, that they have to just keep trying. Well, we dig a little bit deeper. So again, we're looking at the nutritional factors that could be affecting your fertility, making sure that your body is getting everything that it needs for the process to happen naturally. We look at immune factors that could be affecting your fertility. If your body is fighting something else off, it might not necessarily have the energy to actually put forth to a conception. Hormonal factors obviously are also a huge thing here. So making sure that your estrogen and progesterone levels are balanced so that we can support a healthy pregnancy. Things like hypothyroid can also play in on fertility, and stress and adrenal function is something that I treat in a lot of my patients anyways, but is also huge for trying to get pregnant and also for maintaining that happy, healthy pregnancy that we want to see. So, if you have any questions, if you're already engaged in the process, if you're looking to pursue the process, if you just want more information on how naturopathic medicine can help so that you can bring a new tiny human into the world, then ask for Dr. Kathy, Back to Health Wellness. I am here and happy to help. Thanks.
Hello, my name is Dr. Barbara Rodwin and I want to talk about chiropractic and pregnancy. I often get the question when women come in, they'll say, guess what, I'm pregnant. Are you able to still treat me? And I'll say, yes, it's actually perfectly safe and it's very helpful as well. Dr. Kathy mentioned earlier in the video about the different trimesters, and during those different trimesters, I can actually do different types of treatments as well to help with things. And especially in the third trimester, I can actually do some work on the ligaments and the joints to help release and loosen things up. And they've shown that chiropractic adjustments and work can actually help decrease pain and and labor time from studies that they've done. During the whole pregnancy itself, I can help with different issues that arise with the feet, the knees, the hips, the back. Some women come in with sciatic pain, wrist issues, shoulders, headaches, and back problems. The back does, during the pregnancy, change in shape. Our back normally has 3 nice little curves in it, and they look like this. When your baby starts to grow at the front, it actually causes your lower back to flatten out or straighten. That'll put a lot more compression both on the lower back and the hips, and I can actually do work on that to help release all of the joints in the back area. I am also certified in acupuncture. Dr. Kathy has mentioned that already in the video with respect to helping during either during the pregnancy, if you had nausea or other types of problems. It's perfectly safe. You can actually do it too for fertility or induction. There is a patient that will be talking about fertility treatment as well, which you'll see it actually helped her quite a bit too. It's also another technique that I actually practice is known as the Webster technique. So I've gone to certify in that, and that actually helps with breech babies. So babies that are turned the wrong way, I can do certain types of adjustments to help actually return them, and it's really amazing to do that and help the mother with that. I do get a lot of referrals from medical doctors for that, and from online people will find us. You can also think of after the baby's born to be able to help with the mother with when they're breastfeeding with discomfort in the arms. I'll check things and loosen it up. But even having the baby checked after they're born, because different things can happen during the birth process or as they're growing. And that would be it for me for pregnancy and babies. If you have any questions, feel free to email us.
Hi, my name is Kristen, and I'm a patient here at Back to Health. We actually had a lot of trouble conceiving children, and so I was in the process of doing IUI treatments as well as IVF treatments. To complement those treatments, I came to Dr. Rodwin for acupuncture treatments. Right these days, it's a well-known fact that acupuncture coupled with IVF seems to be more successful. So I tried that as well, and I was very lucky in that through my IUI treatments for my first son and my IVF treatments for my second son, we have 2 healthy boys today, age 3 and age 7. There's the 3-year-old. Say hi. And it's been all thanks to our treatment here at Back to Health. So thank you very much, Dr. Rodwin. And acupuncture is painless. Little tiny needles that go in. You can relax for 10 to 15 minutes. And it's been very beneficial for us. So that's just our story. Thanks.
Hi, I'm Carrie Lynn Dudgeon. I'm a kinesiologist and an orthotic consultant at the Back to Health Wellness Center. So in the Back to Health Wellness Center, what I often see with our pregnant patients is I tend to see them actually post-pregnancies. A lot of women during their pregnancies notice that their feet actually change and they actually get slightly wider or notice a half a size difference in their shoes. This is very common occurrence because what happens is there's 2 arches in our feet. There's an arch here that most of us think about, but there's a secondary arch through the front of the foot called our metatarsal or our transverse arch. With weight gain during pregnancy, this often drops. And when it drops, we get a spreading of that part of the foot, hence the width change and the size change. What happens then is these bones though now, there's no longer a fat pad there. So people will sometimes notice pain or bruising, feeling in through the balls of the feet. So that's the most common thing I see post-pregnancy. The other thing that I tend to see is when a patient goes on maternity leave, they're used to wearing footwear in their homes. And now they're home on their hardwood, their laminate, their ceramic floors, pretty much weight training, carrying a baby around their house. And what they find happens is we start to get discomfort in through the plantar fascia in the bottom of the foot. Now the plantar fascia is a thick connective tissue that originates in the heel, gives the arch shape, and it inserts into the front of the foot. So if we're pounding on a hardwood floor all day long, that can cause heel pain, arch cramping, things like that. So I often recommend to patients to wear something in the house to alleviate that strain. People who come to see me postpartum, we also sometimes recommend adding some metatarsal support to their footwear to lift up those dropped arches, or sometimes go into a custom orthotic to accommodate all of those things.